For this presentation, I'm going to be explaining the fors and against for why healthcare should, or if healthcare should, be free or funded by the government. My personal feelings on this topic is that healthcare should be government funded. According to our Declaration of Independence, it is supposed to fit into one of our human rights to have medical care. So, in the research that I've done, it has been known or said or theorized that in the Declaration of Independence, we should have the right to discounted, free, government funded health insurance or health care. This has been a long-standing debate. There's many arguments for why we should have government funded health care, why we shouldn't have government funded health care, but it seems like the more politics that gets involved, the less that we come to a reasonable answer. If we were to look at a system that's already been in place, say Italy's healthcare system, the SSN, it's the best healthcare system in the world, statistically. So, if we were to use that as just an example of what we could potentially have here in the United States, then it could possibly look like or be similar to the taxes that you pay in, that all the citizens pay into, go to primary care or inpatient care. Say, if you needed to go to the doctor's office or for just general basic health needs or routine checkups. And then if you got into an accident and had to go to the hospital. Now, there are exemptions to this. Say, if you need specialized treatment or things along those lines, it puts you into certain categories, and you have to pay like a copay or co-sharing agreement. But even those are reasonable, and certain people fall as exemptions to the copay and co-sharing as well, such as the elderly, pregnant women, children. So, that's just one way that things could possibly work if we were to take Italy's lead and use that as a basic model. Now, I do think that if we had government funded healthcare in the United States, it would be a lot more beneficial to, especially to our unemployed and our homeless. Think of how many unemployed and homeless don't get regular checkups or dental and just basic routine care because they don't have health insurance. I mean, that's a lot of people. And simple colds, the flu, even when it comes to like this pandemic that we just had, think of how much that could have been reduced, the passing of and cross contamination of people, if they had basic health care, if they could get their vaccinations, if they could get their shots. Also, think of long-term critical care. If homeless and unemployed people could get the same health care as the rich or the people that can afford healthcare premiums, then maybe cancer could get caught early, or a terminal illness could be caught in the early stages. So again, these are just sides, one side of the coin. Now, if you were to flip the coin over for the people that are against government-funded healthcare. Now, I think the people that are more against this are the political side. And this is just my opinion, but I also found in my research that not only the political side doesn't really want government funded healthcare because they want to put that money that would be taken towards healthcare and put it towards different things. But also the big companies and big corporations like drug companies, the insurance companies that have monopolized the healthcare industry as far as insurance, they don't want you to get free healthcare either. I mean, think of all the money they would lose. Think of all the people that are getting rich from these companies that they wouldn't make the money they make anymore. So, in my research that I did, I found an article on um, it was healthcare insurance or health insurance companies and big pharma go back and forth on who's causing the drug prices to rise. So they're playing the blame game with each other, but behind the scenes, they actually work together. And the drug manufacturer companies will say, okay, we'll give you a discounted rate if you get so many of this type of drug. And then the insurance companies will make sure that they cover that specific drug they're getting discounted on and not something else that could be used as a better suggestion or a better drug for that instead. So they're both making money, but it's not benefiting anybody but them. You would think the doctors should be the ones that are prescribing what medication would be best for you, but actually it's the insurance company and the drug manufacturers that really decide which drugs you actually are going to get, because to be honest, you're going to get what your insurance covers. So if your doctor says, oh, well, you should really get such and such for this illness, but your insurance doesn't cover it, but instead I can give you this, and this. It's not as good, there's more side effects, but in the end it still will help you. It's just not as good quality, and it might make you a little bit sicker with different side effects, but it's covered from your insurance. The majority of the people are going to take what's covered by the insurance because, let's be honest, most people can't afford the prices that medications are. So, when it comes down to it, from my research, I have came to the conclusion that on the for side of the debate of whether healthcare should be free or government funded, the people would benefit the most, and that's who are for and agree with healthcare being funded from the government or being free. And then on the other side is the big companies and the politics and the government that really doesn't want free healthcare or government funded healthcare because they want to put that money, the government wants to use that money elsewhere to benefit other things, I suppose. And the big companies want to keep lining their pockets. So I guess it's going to be another long debate for many years before we come to a solution. But I really hope that this has been informative for your behalf and it helps you come to a educated decision or conclusion of how you feel on this topic. Earlier I stated that I feel like we should have federal, or not federal, but government funded health care. And hopefully the research that I've done shows and supports my opinion. But again, there's two sides of the debate, and I guess that decision is up to you. Thank you.